In this video, I want to go over ear surgery, specifically tympanoplasty, and what to expect on the day of surgery. A tympanoplasty is a procedure designed to repair a hole in the eardrum, and in some cases to improve hearing if the sound conducting system in the middle ear is not working as well as it should. A hole in the eardrum can happen for a few reasons: trauma, chronic infections, or occasionally from previous procedures like ear tubes or other ear surgery. The goal of surgery is to close that hole and create a healthy, intact eardrum again. This is often done by using your own tissue as a patch, commonly fascia, which is a thin layer of tissue taken from just behind the ear. So, on the day of surgery, you'll report to the surgery center or hospital and get checked in. A nurse will review your medical history, go over routine pre-op questions, and place an IV. After that, you'll meet with your surgeon to review the plan one more time, confirm the details of the procedure, and make sure all your questions are answered. You'll also meet with the anesthesia provider, who will talk with you about anesthesia and what to expect before, during, and after surgery. When it's time, the anesthesia team will take you back to the operating room. You'll move on to the operating table, get comfortable, and breathe oxygen through a mask. Medication is then given through the IV, and you fall asleep. While you're asleep, the anesthesia provider will place an airway to keep you safe during surgery. Depending on your situation, this may be a breathing tube through the vocal cords or an airway that sits above them. Once you're asleep, your ear is cleaned with a sterile solution and you're covered with sterile towels and drapes. The eardrum repair can be performed through the ear canal or sometimes through an incision behind the ear. This depends on the size and location of the perforation and your surgeon's preferred approach. If graft tissue is needed, it is commonly taken from the area near the temporalis muscle, which is behind the ear. That graft is then used to patch and support the healing eardrum. When your surgery is complete, the anesthesia provider will remove the breathing tube and help you wake up. Once you're awake and stable, you will be taken to the recovery room. While you're in recovery, your surgeon will speak with your family, explain how things went, and give any specific instructions for your recovery. You'll stay in the recovery area with nurses who monitor you closely. When you're more fully recovered from anesthesia, you'll be reunited with your family. After receiving instructions about wound care, discussing medications, and when to return to activity, you'll be ready to go home. And that's what to expect on the day of surgery for your tympanoplasty. Now you knows. Thanks for watching.